Hello. The informed consent that I looked at is from Falling Upward Counseling, an LLC owned by David Reed, a licensed mental health counselor in Gainesville, Florida. I believe that he meets most of the ACA requirements noted, as well as Florida Statute 491. So I will walk through the different sections of this informed consent on his website. The first one is my qualifications, and he explains his education, his licensure, his experience, basically meaning what is required to be explained by the ACA Code of Ethics A2B. The next section, risks and rewards of counseling, he explains the benefits of counseling, primarily increased understanding of self and others, and the risks, which are uncomfortable emotions and increased stress, possibly related to the homework involved. He is thorough in describing this dynamic, which also meets ACA A2B. The next section is payment, and he describes that he charges a $100 fee for a 55-minute session. He explains the different payment methods and the cancellation fee. He does not mention any sort of procedure for non-payment, which is something that's noted in the ACA Code of Ethics. The next section is record keeping and confidentiality. Here he explains client rights to any information that is generated during counseling, and also that clients must provide explicit and written consent for any release of information. Florida law requires that counseling records be maintained for 7 years, and he does state that he does this and then destroys the records. The next section is exceptions to confidentiality. He's very thorough here, discussing all the different exceptions that apply. For example, when abuse is suspected, harm to self, harm to others, medical emergency. He discusses non-encrypted technology. So he does a great job being detailed here. The next section, client as a counselor, he explains that clients need to actively participate in counseling, basically act as a consumer, do their homework, clarify needs for themselves in case a plan needs to be modified. Next is the indemnification clause. Here, the client signs acknowledging that counseling is provided by David Reed's LLC, and defend and indemnify the church and all those associated with the church where David's business is located, so that they are protected from liability. And then his final section is consent for treatment. Here, the client signs acknowledging that he or she is giving consent to attend counseling, to fully participate, and to complete an intake assessment. David Reed does provide a separate informed consent for minors, and here he explains the differences in confidentiality rules for minors, and also the effort he takes to ensure their privacy because of their need for independence and autonomy. One aspect I do not see included is the importance of providing informed consent when there's a language barrier or obstacle. This is part of ACA Code of Ethics A2C. It states, when clients have difficulty understanding the language that counselors use, counselors provide necessary services to ensure comprehension. Hunt and Vode wrote a 2007 journal article titled, Are Good Intentions Good Enough? Informed Consent Without Trained Interpreters. Here they describe communication problems related to the use of untrained interpreters or reliance on a clinician's own limited second language. And they concluded that patients appear to be consistently disadvantaged in each of the criteria they examine, even when translators were used. It was uncertain whether patients were provided with quality and content of information needed to assure that they are genuinely informed. Things that I did not see that are listed in the ACA Code A2B but were not identified by David Reed include techniques and procedures he uses, limitations, approach to counseling, continuation of services, role of technology, implication of diagnosis, tests and reports, advisement regarding refusal of services. So if David Reed intends to cover these verbally, which I believe is fine, he should keep careful documentation of this. ACA Code of Ethics states that counselors have an obligation to review in writing and verbally with clients. So for the most part, I believe David's informed consent does a great job of covering all that is required. Thank you for listening.